Welcome to Emergency Insights. I'm your host, James Carter. Today, we're looking into a topic that many of you face, the ACLS Megacode exam. It's a high-pressure test where every second counts. To help us navigate the common pitfalls, we're honored to have Dr. Amy Liu, a critical care expert with years of experience in emergency medicine. Dr. Liu, welcome.
Thank you, James. It's great to be here. The Megacode exam is a crucial step, and I'm glad we can discuss how to master it.
Excellent. Let's get straight into it. The exam is designed to test a provider's ability to lead a team in a cardiac arrest scenario. So what would you say is the number one mistake you see candidates make during this exam?
The most critical mistake, and often the first one, is inadequate patient assessment. Candidates often rush into interventions without a thorough initial assessment. They fail to check vital signs properly or don't take a moment to consider the patient's history. This haste can lead to missing subtle but crucial clues that would completely change the treatment path. A quick yet complete assessment is the foundation for everything that follows.
That makes perfect sense. So a solid assessment lays the groundwork. What's the next common error you've observed?
Mistake number 2 is a delay in recognizing and addressing the cardiac rhythm. ECG interpretation is the cornerstone of ACLS. Many candidates hesitate or misread the rhythm, leading to incorrect treatment. For example, confusing ventricular tachycardia with ventricular fibrillation can lead to the wrong intervention, which can be devastating. Practicing rhythm recognition drills is vital to build the speed and accuracy needed to make a rapid, correct decision.
So speed and accuracy in rhythm interpretation are key. My next question is about communication. The Megacode is a team-based exercise. What communication errors do you see?
Poor teamwork and communication are a huge pitfall. ACLS is never a solo mission. Without clear communication, a team can devolve into chaos. We see candidates who don't speak clearly, don't assign roles at the beginning of the scenario, or fail to follow the established ACLS algorithms. Effective communication ensures everyone knows their role, from compressions to medication administration, which streamlines care and improves patient outcomes. It's about leading the team, not just performing actions.
Leadership and communication are definitely non-negotiables. Moving on to clinical skills, what's another critical area where candidates often falter?
The fourth mistake is neglecting airway management. Airway control is paramount, and inadequate oxygenation or ventilation will worsen a patient's condition regardless of what other interventions are performed. I've seen providers use techniques that don't ensure effective oxygen delivery, or they fail to monitor for signs of hypoventilation. You need to know when to escalate to an advanced airway device and be proficient in using it correctly to prevent hypoxemia and carbon dioxide buildup.
It's a reminder that the basics of ABCs are always critical, even in advanced care. For our final point, let's talk about medications. What do providers need to know to avoid mistakes?
The final mistake is insufficient knowledge of ACLS medications. Drugs are lifesavers, but only if they are used correctly. Candidates sometimes make errors with dosages, or they choose the wrong medication for the rhythm presented. It's not enough to know the drug name. You must understand its pharmacodynamics, the correct dose for the situation, and the potential side effects. You also need to monitor the patient's response to the drug and be ready to adjust your treatment plan promptly based on that response.
Dr. Liu, this has been an incredibly insightful discussion. To recap for our listeners, the top 5 mistakes to avoid are inadequate patient assessment, delays in rhythm recognition, poor teamwork, neglecting airway management, and insufficient knowledge of ACLS medications. Thank you so much for sharing your expertise with us today.
My pleasure, James. I hope this helps healthcare providers feel more prepared and confident for their exams.
And that brings us to the end of another episode of Emergency Insights. Stay safe, stay sharp, and we'll see you next time.